Pharmacology for NCLEX, tips and tricks plus example questions. Hi everyone, I'm here with Level Up Arn. In this Pharmacology for NCLEX video, we are going to talk about high-yield medications. So make sure you watch this entire video so you don't miss any of the important information that I am going to share with you. And in this video, we're going to discuss the following. What is pharmacology? Why is it important for nursing? The different routes of medication administration, common side effects of medications, as well as high-yield medications that you need to know for the NCLEX. Okay, so let's start out with what is pharmacology. Pharmacology is the study of drugs and their effects on the body. It is a branch of medicine that is concerned with the origin, properties, uses, and effects of drugs. And pharmacology is important for nursing because as a nurse, you will be administering medications to patients and you need to know how those medications work in order to administer them safely and effectively. Now, there are many different routes of medication administration. For example, there's oral, topical, intravenous, intramuscular, and subcutaneous. Each route has its own advantages and disadvantages in terms of how quickly the medication is absorbed and how effectively it is distributed throughout the body. Alright, now let's talk about common side effects of medications. So anytime you're giving a medication, you have to be aware of the potential side effects. And here are some of the most common ones: nausea, vomiting, diarrhea, constipation, headache, dizziness, and vertigo. Alright, now let's move on to high-yield medications that you need to know for the NCLEX. I'm only going to cover a few here, but you can find a more comprehensive list in my nursing school cheat sheet, which is linked below. So the first one is morphine. Morphine is an opioid agonist and it's used to treat moderate to severe pain. It is important to monitor patients closely for respiratory depression, which can be life-threatening. The next one is nitroglycerin. Nitroglycerin is a vasodilator and it's used to treat chest pain or angina. It's also important to monitor patients closely for hypotension, which can lead to dizziness or fainting. Alright, now let's talk about insulin. Insulin is used to treat diabetes mellitus and it is a hormone that regulates blood sugar levels. It is important to monitor patients closely for hypoglycemia, which can cause symptoms like shaking, sweating, and confusion. The next one is digoxin. Digoxin is a cardiac glycoside and it's used to treat heart failure and atrial fibrillation. It is important to monitor patients closely for signs of dig toxicity, which can include nausea, vomiting, and visual disturbances. Alright, now let's talk about phenytoin. Phenytoin is an anticonvulsant and it's used to treat seizures and other types of epilepsy. It is important to monitor patients closely for signs of toxicity, which can include tremors, ataxia, and confusion. Alright, now let's move on to vancomycin. Vancomycin is an antibiotic and it's used to treat serious bacterial infections. It is important to monitor patients closely for nephrotoxicity and ototoxicity, which can lead to hearing loss. Now you should know that this is not an all-inclusive list and there are many other medications that you need to know for the NCLEX. Okay, so I hope this review helped you out. If it did, please leave me a comment and let me know. I'd appreciate it.